Welcome to Damal Consult Career Academy. In today's video, we will be discussing a crucial topic for all aspiring nurses: registered nurse interview questions and answers. Preparing for an interview can be daunting, but we're here to help you navigate through it with ease. In this video, we will cover some of the most common questions you might encounter in a registered nurse interview and provide you with insightful answers to help you stand out. Whether you're a new graduate or an experienced nurse looking for a new opportunity, this video will equip you with the knowledge and confidence you need to ace your interview. So, let's get started. 1. Can you tell us about your experience working as a registered nurse? I have been working as a registered nurse for the past 5 years at Catherine Hospital. My experience spans various departments, including medical, surgical, pediatrics, and maternity care. I've been responsible for patient assessments, administering medications, wound care, and collaborating with interdisciplinary teams. This diverse experience has equipped me with the skills and knowledge necessary to provide high-quality patient care. 2. How do you handle stressful situations in a fast-paced healthcare environment? In stressful situations, I prioritize tasks, remain calm, and focus on the most critical issues first. I rely on my training and experience to make quick, informed decisions. Additionally, I use stress management techniques such as deep breathing and taking brief breaks when possible. Effective communication with my team also helps ensure that we work together efficiently during high-pressure situations. 3. Can you describe a challenging patient care situation you've encountered and how you managed it? I once cared for a patient with severe COPD who was experiencing respiratory distress. Despite initial treatments, the patient's condition was deteriorating. I quickly notified the attending physician and respiratory therapist, initiated high-flow oxygen, and prepared for potential intubation. My prompt actions and collaboration with the healthcare teams stabilized the patient and prevented further complications. 4. How do you ensure patient safety and infection control in your practice? Patient safety and infection control are top priorities. I adhere strictly to hand hygiene protocols, use personal protective equipment (PPE) appropriately, and follow aseptic techniques during procedures. I also stay updated on the latest infection control guidelines and participate in regular training sessions. By maintaining a clean and organized environment, I minimize the risk of infections and ensure patient safety. 5. How do you approach communication with patients and their families? Effective communication is crucial in nursing. I use clear, simple language to explain medical conditions, treatment plans, and procedures to patients and their families. I encourage questions and provide compassionate, honest responses. By actively listening and showing empathy, I build trust and ensure that patients and their families feel supported and informed. 6. How do you handle conflicts or disagreements with colleagues in a healthcare team? I handle conflicts by addressing them promptly and professionally. I believe in open communication and try to understand the perspectives of all parties involved. I remain calm and respectful and focus on finding a solution that benefits patient care. If necessary, I seek the guidance of a supervisor or mediator to help resolve the issue. 8. How do you stay updated on current healthcare practices and guidelines? I stay updated on current healthcare practices by regularly attending professional development courses, workshops, and conferences. I also subscribe to reputable medical journals and participate in online forums and webinars. Additionally, I engage in peer discussions and seek feedback from colleagues to continuously improve my knowledge and skills. 9. Describe a time when you had to handle a medical emergency. While working in the emergency department, I encountered a patient who went into cardiac arrest. I immediately initiated CPR and called for the emergency response team. I continued to provide chest compressions and assisted with advanced life support measures until the patient was stabilized. My quick response and adherence to emergency protocols were crucial in managing the situation effectively. 10. How do you ensure patient confidentiality and privacy in your practice? I adhere to strict confidentiality protocols by ensuring that patient information is only shared with authorized personnel and is securely stored. I avoid discussing patient details in public areas and use privacy screens when providing care. Additionally, I educate patients about their rights to privacy and confidentiality to build trust and maintain professional integrity. 11. Can you describe your experience with administering medications and managing dosage regimens? I have extensive experience in administering medications, including oral, intravenous, and intramuscular routes. I follow the 5 rights of medication administration: patient, right medication, right dose, right route, and right time. I also closely monitor patients for any adverse reactions and adjust dosages as needed in consultation with physicians. My meticulous attention to detail and adherence to protocols ensure safe and effective medication management. 12. How do you handle situations where a patient refuses treatment or medication? When a patient refuses treatment or medication, I first seek to understand their reasons and concerns. I provide clear information about the benefits and risks of the proposed treatment and address any misconceptions. If the patient continues to refuse, I respect their autonomy and document the refusal in their medical record. I also inform the attending physician and explore alternative options to ensure the patient receives appropriate care. 13. Can you discuss your experience with wound care and infection management? I have extensive experience in wound care, including assessing wounds, performing dressings, and monitoring for signs of infection. I follow evidence-based guidelines to manage wounds effectively and prevent infections. For example, I use aseptic techniques, select appropriate dressings, and educate patients on proper wound care practices to promote healing and prevent complications. 14. How do you ensure effective communication with non-English speaking patients? I ensure effective communication with non-English speaking patients by using professional medical interpreters and translation services. I also use visual aids, gestures, and simple language to convey information. Additionally, I work with culturally competent care teams to ensure that the patient's cultural and linguistic needs are met. 15. Describe a time when you had to lead a team or take charge of a patient's care. During a quality improvement initiative at Catherine Hospital, I led a project to reduce hospital-acquired infections. I coordinated a team of nurses to review current practices, identify areas for improvement, and implement new infection control protocols. I also organized training sessions and monitored compliance. The project resulted in a significant decrease in infection rates, demonstrating my ability to lead and drive positive change. 16. How do you ensure documentation accuracy and completeness in patient records? I ensure accurate and thorough documentation by meticulously recording all relevant patient information, including assessments, interventions, and outcomes. I use standardized forms and electronic health records to maintain consistency and clarity. I also double-check entries for accuracy and completeness to ensure that patient records are reliable and up-to-date. 17. Can you discuss your experience with patient education and health promotion? My approach to patient education and health promotion involves providing clear, concise information tailored to the patient's level of understanding. I use visual aids, handouts, and interactive demonstrations to enhance learning. I also encourage patients to ask questions and actively participate in their care. By empowering patients with knowledge, I help them make informed decisions and adopt healthier lifestyles. 18. How do you prioritize tasks and manage time effectively in a healthcare setting? I prioritize tasks by assessing their urgency and impact on patient outcomes. I create a to-do list at the start of each shift and adjust it as needed based on changing priorities. I also delegate tasks appropriately to ensure efficient workflow. Effective communication and collaboration with the healthcare team help me manage time and deliver high-quality care. 19. Describe a time when you had to collaborate with other healthcare professionals to achieve a common goal. In one instance, I worked with a multidisciplinary team to develop a care plan for a patient with multiple chronic conditions. By collaborating with physicians, pharmacists, social workers, and physical therapists, we created a comprehensive care plan that addressed the patient's medical, emotional, and social needs. This collaborative approach improved the patient's overall health outcomes and quality of life. 20. What qualities do you possess that make you a good fit for this registered nurse position? I possess strong clinical skills, effective communication abilities, and a compassionate approach to patient care. My dedication to continuous learning and professional development ensures that I stay updated with the latest nursing practices. Additionally, my ability to work well under pressure, prioritize tasks, and collaborate with interdisciplinary teams makes me a valuable asset to any healthcare organization. My commitment to patient safety and high-quality care aligns perfectly with the values of this institution. Thank you for watching this video on registered nurse interview questions and answers. We hope you found the information helpful and feel more prepared for your upcoming interview. Remember, the key to success is not just having the right answers, but also conveying your passion and dedication to patient care. At Damal Consult Career Academy, we're committed to helping you achieve your career goals. If you enjoyed this video, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more career tips and advice. Good luck with your interview, and we'll see you in the next video.